Hi, my name is Neil Lakdawala. I'm a cardiologist at the Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts, who specializes in the care of patients with genetic cardiomyopathies, and I do research in the same area. I'm going to talk about cardiomyopathy associated with FLNC gene variants, or Filament cardiomyopathy. Filament cardiomyopathy is a relatively recently described autosomal dominant genetic cardiomyopathy. It wasn't until approximately 2016 that our community recognized the importance of gene variants in FLNC as a major, or as an important cause of cardiomyopathy. What sets filament cardiomyopathy apart from many other similar diseases is the propensity to ventricular arrhythmias. And broadly, people will sometimes categorize filament cardiomyopathy as an arrhythmogenic cardiomyopathy, meaning that arrhythmias supersede or precede the development of other problems associated with cardiomyopathy, such as congestive heart failure. And in particular, these are ventricular arrhythmias, or arrhythmias where the bottom chambers of the heart beat fast, irregularly. And we are concerned about ventricular arrhythmias because they are the major cause of cardiac arrest for patients with cardiomyopathy. Unique for filament cardiomyopathy is how we go about understanding which of our patients is at increased risk for ventricular arrhythmias and cardiac arrest. This is the idea of risk stratification. And unlike other forms of cardiomyopathy, where most of the risk is limited to people with very severe weakening in their heart muscle, or in a sense, very severe cardiomyopathy, we've learned that patients with filament cardiomyopathy are at increased risk for ventricular arrhythmias as soon as there is some degree of systolic dysfunction, meaning that there's some impairment in how vigorously the heart muscle pumps. The other features that can identify a patient at increased risk for life-threatening arrhythmias include non-sustained ventricular tachycardia, fainting, and in a subset of patients, their age may also be prognostic or tell us something about their future risk. And so when I see a patient with filament cardiomyopathy, I take these factors into account and will make guidance about what should be done to protect them from cardiac arrest. And largely speaking, protection comes in the form of an implantable cardioverter defibrillator, or an ICD, which can recognize and terminate life-threatening arrhythmias with a high degree of success. So that is, I think, the most important unique consideration for patients with filament cardiomyopathy is their heightened risk of ventricular arrhythmias and cardiac arrest, and the growing specific way that we understand individuals' risk with this condition and go about deciding who would benefit from a defibrillator. We're still learning a lot about what disease progression looks like for filament cardiomyopathy. In my practice and in others who look after this disease, we keep a careful eye on the left ventricular ejection fraction as a measure of cardiac function. This is usually done with a cardiac ultrasound or an echocardiogram. And if the ejection fraction declines, and especially below 40%, we generally recommend several medical therapies to protect cardiac function. Many of us consider using these same medicines even when ejection fraction is just minimally depressed. However, we need to learn a lot more about how our patients respond to these medicines. We are making these recommendations based on the generic experience with these drugs for patients with cardiomyopathy, where they're quite effective. But more research is necessary to understand how patients with filament cardiomyopathy benefit from these medicines. I think the future is bright for genetic cardiomyopathy. We've learned so much about filament cardiomyopathy in the first 10 years of our appreciation of the condition. My team is leading efforts to gain a better understanding of how patients respond to medical therapies, about the unique role of in inflammation episodes, and we hope the development of new therapies for filament cardiomyopathy. However, more research is necessary and will require partnership between patients and researchers, and hopefully entities that are going to develop new therapies for filament cardiomyopathy. Thank you.
This video is part of a series of educational videos developed by the Genetic Cardiomyopathy Awareness Consortium and brought to you by the DCM Foundation. Our goal is to connect you with the leading experts in the field of cardiomyopathy to further your understanding of this disease and to provide resources to help you manage your care. Thanks for watching.